So, yeah, this disease struck. You may have heard of it. It's called COVID-19, and really changed the way that hospitals were working because we were totally swamped. Hospitals full, most services like ID, critical care, and everyone really needed people to help out. And I think our program did a good job of looking for volunteers, but not forcing anybody to do things and detracting away from their education. So, for example, they reached out and said, does anyone want to do extra critical care time? And me and a couple other residents did some extra time for those of us that were interested in it. And we shuffled a couple people here and there, but for the most part, did a good job protecting people's educational time because they still have to do other electives, learn other specialties. Eventually, they're going to continue to treat diseases that are not COVID. So it's important to learn those. And even when a couple attendings reached out trying to pull residents from different electives, our program stood up for them and said, no, they have their educational work that they need to do. And that was something I was really proud our program did.
So one of the ways that COVID has affected our program, obviously it's affected all programs around the country. We've seen a large tick in our ICU, obviously, but the amount of support that we've gotten both from our upper level residents, our ICU attendings has been wonderful. I know mental health has been something that a lot of practitioners are struggling with, particularly as an intern. I know nursing staff and different ancillary staff have struggled with that as well, but the program has definitely taken into their hands to make that something of importance for us. If there are people who are struggling, if they need to talk to somebody, we've definitely integrated different pieces into our program to help with that, and that's been just such a blessing for myself, personally, and I hope for everybody else in the program as well.
Towards the end of my intern year was when COVID kind of started coming to the forefront, lockdowns were happening, and it was obviously very scary for all of us, being at the kind of front lines of healthcare at the time. Our program was very proactive, immediately starting systems to distance us, and of course some things, major things had to change at that time, it being didactics, number of people who were working in the hospital at any given time. And our program was extremely flexible in making sure we still had the learning opportunities maintained with virtual didactics, and making sure we all had a safe experience in the hospitals. Inevitably, residents had to work with COVID patients, but we all had all the protective equipment we needed early on, and support from attendings to do so. So we all felt very safe being here, and we also got a really wonderful learning opportunity. With it being so ever present in our lives, we had a really good opportunity to learn what COVID meant and how we could help. Even now we have programs where we're going out in the community and helping to educate on vaccines with our faculty, which is a really great opportunity to dive deeper into the community and help out beyond just our work hours. So our program is extremely proactive in any changes that come up as well. With the new kind of wave that we can maybe start seeing, we're ready to kind of tackle whatever comes our way, and I definitely have great trust in our kind of chiefs and faculty to handle it appropriately.